Thank you for joining me today. In this video, we are going to learn more about electrolytes disorders that affect mental health. Some electrolytes can help with the mental health. Electrolytes are essential minerals that regulate neuroexcitability and neurotransmitters, muscle contractions, cardiac conductions, acid balance regulation, fluid homeostasis. Even mild electrolytes disturbance can lead to production of a significant psychiatric neurological manifestation, while a severe abnormality can result to delirium, seizure, coma, and death. So electrolytes can lead to delirium, psychosis, seizure and coma, and death. Clinicians must recognize the electrolytes disorders that mimic primarily psychiatric illness and identify the psychiatric medications that contribute electrolyte imbalance and collaborate with medical providers to ensure a timely diagnosis and treatment. We are going to learn and explain the role of an electrolyte in normal brain function. We are going to recognize the psychiatric manifestation of a common electrolyte abnormality. We are going to learn differential electro-induced psychosis symptoms from primary psychiatric disorders. We are going to interpret and explain a common laboratory findings, identify psychiatric medications that associate with electrolyte disturbance. We are going to learn how to develop appropriate assessment, referral, and monitoring plans. Importance of electrolytes in mental health. How electrolytes are important to mental health. Electrolytes maintain neuromembrane potential, neutral membrane potential, neurotransmitter release. So they are not going to release if you don't have electrolyte imbalance. Synaptic transmission. They maintain synaptic transmission. They maintain neuron membrane potential. They maintain electrolytes, maintain neurotransmitter release, maintain muscle contraction and contraction. They maintain cardiac electric activity. They maintain fluid balance. Electrolytes maintain acid balance homeostasis. Electrolytes abnormality. present and lead to depression, anxiety, irritability, confusion, delirium, hallucination, psychosis, memory impairment, cognitive dysfunction, seizure, and change of level of consciousness. Major electrolytes include sodium, potassium, calcium, magnesium, phosphorate, and chloride. So sodium disorder, low sodium, generally defined as sodium level that less than 135. And what causes the low sodium include SAD, particularly older adults if they have SIADH, SAD disorder, if they taken carbamazepine medication can cause low sodium. Oxcarbazepine can cause low sodium. Psychotropic polydysplasia can cause low sodium. Heart failure, kidney failure, liver failure can cause low sodium. When you have a low sodium, you can have psychiatric manifestation of fatigue, irritability, anxiety, poor concentration, confusion, delirium, hallucination, agitation, psychosis. Even psychosis, you can develop psychosis if your sodium level is low. If your sodium level is more low and severely low, it can cause seizure and coma and respiratory failure. So patients with schizophrenia are at high and increased risk because of the psychiatric medication and psychogenic polydipsia. Psychogenic polydipsia. Psychogenic polydipsia is increased risk for patients with schizophrenia. Older adults who are receiving antidepressant medications require close monitoring of sodium level, particularly first week of the antidepressant medication, especially SSRIs. High sodium is sodium level of higher than 145. High sodium is caused by dehydration, diabetic insipidus, inadequate water intake, asthmatic, diuretics, and psychological manifestation of high level of sodium include restlessness, irritability, confusion, lethargy, delirium, and agitation. Severe hyponatremia or high sodium can lead to seizure and coma. Sodium disorders. Low sodium is less than 3.5. Less than 3.5. Low sodium is caused by diuretics, medication called diuretics, Pharmarin if the patient is sick, and Pharmarin, diarrhea, eating disorder. Laxative can cause low sodium. Hyperaldosteronism. Hyperaldosteronism is the disorder and can cause low sodium. Low sodium, low potassium. Low potassium is caused by, low potassium is less than 0.3, less than 3.5. Low sodium is the less than 3.5. Low sodium, not low sodium, low potassium is caused by diuretics. Low potassium is caused by Pharmarin, diarrhea, eating disorder, laxative, hyperaldosteronism, hyperaldosteroid can cause low potassium. Low potassium psychiatric symptoms include fatigue, weak, apathy, irritability, reduced concentration. Clinical importance of low potassium increases the risk of cardiac rhythm, particularly patients taking a medication that prolongs QT, prolongation like the antipsychotic medication. So antipsychotic medication increases the QT prolongation, increase the risk of a QT prolongation, arrhythmia, cardiac arrhythmia. So if the potassium is low, it also leads to cardiac arrhythmia. So together, they increase the risk. High potassium is defined as higher than 5.0, and high potassium can cause anxiety, weak, and confusion. Calcium, low calcium can lead to anxiety, depression, irritability, emotional liability, and confusion and memory impairment. So low calcium leads to anxiety. Low calcium leads to depression. Low calcium leads to irritability, confusion, emotional liability, and memory impairment. Severe low calcium, so the low calcium is more low and is severe. In severe cases, it can cause tetany, seizure, and delirium in severe cases. How about if the calcium is high? If the calcium is high, what caused the calcium to be high is primarily hypoparathyroidism. Hypoparathyroidism, because parathyroidism is responsible in absorbing the calcium, and parathyroid regulates the calcium. So hyperparathyroidism, that means parathyroid is a high. It causes high calcium. Malignancy, also the cancer, can cause cancer that destroy the bone, can cause hypercalcemia, higher calcium. If you take a lot of vitamin D, that can lead to higher calcium level in your blood. Certain medications can lead to higher calcium. Higher calcium, I mean 5 or higher. Calcium level of 5 or higher. So, if the calcium is high, it can lead to psychiatric overdose. Psychiatric overdose, that is the symptoms of depression, apathy, fatigue, confusion, cognitive slowing, memory impairment, anxiety, and sometimes psychosis. Magnesium. How magnesium affected mental health? Low magnesium is caused by alcohol disorder, malnutrition if you are not eating enough nutrition, chronic diarrhea, that you are losing the magnesium because you are having a chronic diarrhea, you are losing the potassium, magnesium because you have alcohol disorder, because the alcohol diuresis the magnesium. If you are not getting enough nutrition that you can get from magnesium, proton pump inhibitor usage, that's the medication. Proton pump inhibitor medications. Diuretic therapy. If you are taking diuretic medication, you can lose potassium, and that causes low potassium in your blood. So if you have a low magnesium, or if the patient have a low magnesium, they can have anxiety, irritability, depression, agitation, and confusion. And if the magnesium is severely low, it can lead to tremor, seizure, and arrhythmia, heart palpitation, or heart failure. How about if the magnesium is high? If the magnesium high, hypermagnesiemia, is the magnesium high in your blood level. When they check your blood level, how much magnesium you have magnesium in your blood or patient blood, they have higher concentration of magnesium. That can cause confusion, lethargy, drowsiness, reduced reflexes, respiratory depression, and coma if the magnesium is high. How about phosphorate disorder? Phosphorate can also affect the mental health. And manifestation of low phosphorate in your blood can lead to anxiety, confusion, delirium, irritability, cognitive impairment. Common causes of low phosphate include malnutrition, alcoholism, referring syndrome, diabetic ketoacidosis treatment, high phosphorate in your blood, usually high phosphatemia, usually is a secondary to chronic kidney disease, and that can affect a psychiatric disorder. And psychiatric symptoms are generally indirect and relate to combined hypoglycemia or uremia. How about chloride? Abnormal chloride can cause the patient to have fatigue, confusion, cognitive impairment, and delirium. Psychiatric medication that causes electrolytes abnormality include SSRIs. SSRIs leads to low sodium, especially older adults. Carbamazepine leads to low sodium also. Oxcarbazepine also leads to low sodium. Lithium leads to high sodium. Chronic kidney disease, diabetic insipidity, diuretic medications for medical conditions like the heart failure. If you take in diuretic medication for heart failure, kidney failure, they lower everything. They lower sodium, they lower potassium, they lower magnesium. So if the patient is taking diuretic medication because they have medical conditions with the psychiatric condition, you have to assess their electrolyte, sodium, potassium, magnesium. Laxative can also lead to low potassium and dehydration. You want to also evaluate the lab value of basic metabolic panel, complete metabolic panel, blood magnesium level, serum phosphorate, calcium, osmolarity, urine sodium, and urine osmolality, kidney function, electrocardiogram or ECG, because some of the electrolytes can lead to, as we mentioned, QT prolongation, arrhythmia with the psychiatric medications. So you want to assess you want to review the medical, you want to review the medication, fluid intakes and hydration status. You want to assess the nutrition level, substance usage history, medical comorbidity, kidney and endocrine disorders, neurological examination. Since they have depression and anxiety and irritability, you want to assess HI and SI and viral signs. So delirium is a medical emergency because electrolytes causes electrolyte disorders cause delirium, and delirium is a medical emergency. Any patient with acute confusion and fluctuation of a consciousness or changing level of consciousness should be evaluated for metabolic and electrolyte abnormality before primarily psychiatric disorder or diagnosis made. You want to check the sodium level in older adults, those who are taking SSRI medication, patient who is receiving carbamazepine and oxcarbazepine, who develop new confusion, fall risk, lethargy, and worsening of psychiatric symptoms. You want to check the sodium level. Lithium therapeutic, you want to assess the lithium therapeutic, and it's require ongoing monitor of a kidney function, fluid balances, electrolytes, because dehydration and sodium depletion can lead to lithium level, can increase the lithium level and can lead to toxicity. Patient with eating disorder, alcohol usage disorder, prolonged vomiting, diarrhea, and laxative, and misuse are at particularly high risk for clinical significant electrolyte abnormality. So you want to assist that. You want to assist the medical conditions and the medication, all the medication that they taken for other conditions besides the psychiatric disorders. You want to closely monitor and collaborate with primary care, emergency medicine doctors, kidney or nephrologist, internal medicine when the electrolyte disturbances are suspected, and correct for the underlying abnormality that can lead to significant improvement in the psychiatric symptoms. Thank you for joining me today. Please subscribe and join me back.